Good morning from the Philippines. This is Dr. Shalona McFarland, and today I am going to talk about root canals. So I had a patient yesterday come in, and he had just gotten a root canal, and it's the second one he's ever had. And so I was explaining to him how sometimes our symptoms that we're experiencing may be coming from root canals. I'm going to fix this camera really quick, maybe. It seems kind of, yeah, that's better. It seemed kind of smudgy. So there is a fabulous book out called The Root Canal Cover-Up. And it came out, I want to say in the 90s, maybe early 2000s, maybe even before that. I don't have it on me. It's back home, and I didn't pull it up online before I did this. Hi, Chuck. So, at any rate, this book, The Root Canal Cover-Up, it explains how root canals can be very toxic to the body. So, did you know that dentists are the only profession that is allowed to leave dead tissue in your body? When you go in and do a root canal, you kill the nerve, right? Well, the nerve is what keeps that tooth alive. And so they essentially kill that tooth, then fill it or cap it or whatever they need to do to that specific one. And then they just leave that dead tissue in your body to do whatever it needs to do. So when you have dead tissue in your body, it has a tendency to rot. It has a tendency to capture toxins and release those into the body. So one of the cases in particular he talks about in the book, hi Colleen, is a gal who had a couple of root canals, and not very long afterwards, a few weeks after she'd had these root canals, she started having some really strange symptomatology, like she had MS, like she was having, her vision would go away, and then her legs would go, and then she would be in a wheelchair, and then she'd be able to walk again, and then she was back into a wheelchair. So it was like demyelinization in MS, but nothing tested for MS. So she's trying to figure out what the heck is happening. She really cleaned up her diet and started eating better, and that helped, but it still didn't stop the process. And finally, somebody told her, maybe it's your teeth. And so she went in and she had those 2 root canal teeth removed. And, hi Claudine. And within a week, all of her symptoms disappeared. Like every single one of her symptoms were gone, and they didn't come back. Then they took those teeth that she had pulled and they inserted them under the skin of a rabbit. And I think there was 2 or 3 of them that they pulled. I can't remember. I haven't read the story in a while, but I'm pretty sure it was 2 or 3 teeth. They put them in a couple different rabbits. Within like another week or so, those rabbits they put them in came down with the exact same symptoms that she had been experiencing for the last couple, 3 years. She'd been that way for a while. So that was the toxicity that those teeth were causing, that dead tissue was causing in her body. So one of the other correlations that has been made with root canals is particularly in women who have been diagnosed with breast cancer. There is a 98% connection with root canals and breast cancer on the same side. So that's a little scary. I personally would not do a root canal. I would just have that tooth removed if it needed to happen. Or I would find a natural way to correct the problem. Clove is a wonderful painkiller for the mouth. It is a hot oil, so I do not recommend putting it on like wounds on the skin. My son has done that, and he said, yeah, it burned like fire, but then it went numb. So if you're okay with that, you can do that. But when you put clove in your mouth, it is hot and spicy. However, it does numb your mouth. Like, it numbs everything it touches. So if you get it on your tongue, on your cheek, on your nose, like, it numbs everything, like you've been to the dentist. So that's something that can help with pain control, at least, but it's not necessarily going to heal the problem. I have to research a little bit to see exactly what kind of things can actually heal root canals, but I know there are or vitamins, herbs, supplements, things out there that can actually heal root canal, or teeth that need a root canal. So here's the other thing about root canals. Dentists make a lot of money off of those. So they're going to recommend them probably more frequently than they should. I know when Grant, my youngest, was about 7, he was having a tooth that was really bothering him. And I took him to a different dentist, not his normal dentist. And he recommended giving him a root canal. I'm like, who's stupid enough to do a root canal on a baby tooth that's going to fall out? It was a baby tooth. It was not one of his permanent teeth. And oddly enough, within a week, that tooth fell out. Crazy. So think before you act. Don't take the doctor's word as solid gold, because it may be driven by something else, and it may not be the best option for you or your loved one or whatever. So think about that. Again, the book is called Root Canal Cover-Up. You can also go to pubmed.gov, pubmed.gov, so Public Medical Research from the government, pubmed.gov. And you can look up research on root canals and see what comes up. There might be some pretty interesting information in there. The more specific you are with your search there, the more specific research you're going to get back. So just some tools for you to have to think about and to see if that is something that works for you. A lot of my patients back home in the States would go down to Mexico to get their teeth fixed, and they are not root canal happy down there. They actually do things a little bit more naturally. So there you go. Food for thought for the day. Root canal cover-up, pubmed.gov, and see if that helps you in your situation today. God bless, guys. I will see you next week. Have a blessed week. Love y'all. Bye.